Hi, I'm Angela, a medical surgical telemetry nurse, and these days, someone living with a triple-negative breast cancer diagnosis myself. Once the diagnosis settles in, the next big question is, okay, so what actually happens now? There are three main tools your care team reaches for: chemotherapy, surgery, and radiation. In this one, I want to walk through what each does in plain language, and just as important, which side effects are expected versus which ones mean pick up the phone.
Let's start with chemotherapy. Since TNBC doesn't have hormone receptors or much HER2 protein, the treatments that target those don't work here. So chemo, and often immunotherapy alongside it, becomes the backbone of the plan. For early-stage TNBC, a common approach pairs a taxane and carboplatin with an immunotherapy drug called pembrolizumab, usually given before surgery to shrink the tumor, followed by doxorubicin and cyclophosphamide. As for what you'll feel, hair loss, fatigue, nausea, mouth sores, and numbness or tingling in your hands and feet are common, and very manageable with the right support. But there's one rule that's non-negotiable. If you develop a fever of 100.4 degrees or higher during chemo, that's a medical emergency. Call your team immediately, day or night. Your immune system is down, and infection can move fast.
Next, surgery. Most people choose between two paths. A lumpectomy removes just the tumor and a thin margin around it. You keep most of your breast, recovery is quicker, and it's almost always followed by radiation. A mastectomy removes the entire breast, and depending on your case, you may not need radiation afterward. Your surgeon may also check your lymph nodes. A sentinel node biopsy removes just a few, while a full axillary dissection removes more and carries a higher risk of lymphedema or arm swelling. Afterward, some soreness, numbness, and a temporary drain are completely expected, but redness, warmth, or drainage at your incision, a fever, or sudden swelling and pain in an arm or leg are signs to call your surgeon right away.
Then there's radiation. High-energy beams aimed at the exact spot where the cancer was, to lower the chance it comes back. It's almost always used after a lumpectomy, and sometimes after a mastectomy if the tumor was large or lymph nodes were involved. Most people go 5 days a week for 3 to 6 weeks, and shorter schedules are becoming more common too. During treatment, expect your skin in that area to look and feel a bit sunburned, redness, peeling, or darkening, along with breast swelling and fatigue that tends to build as the weeks go on. Those are normal. What's not normal, skin that blisters or opens up, or new numbness, weakness, or pain running down your arm. Those need a call to your radiation team, not a wait and see.
So here's the part I really wish someone would lay out plainly: what's expected and what's worth a call. Across all three treatments, fatigue, nausea, hair loss, mild skin changes, some numbness, and a bit of swelling are common and manageable. But a fever beyond 100.4 or higher, redness or drainage at an incision or radiation site, skin that's blistering or breaking down, chest pain or trouble breathing, or sudden swelling and pain in an arm or leg, those mean call your care team. Don't wait to see if it gets better on its own. Catching things early almost always makes them easier to treat. Treatment looks different for everyone, and your own care team is the best guide for your specific plan. I'm just sharing what I've learned so far because as I'm figuring this out myself, I want someone to say it plainly. Sources and more resources are linked below and on my site. Take care of yourself out there. I'll see you in the next one.